Yeah. Which of the following abdominal quadrant does the stomach is situated? The correct answer is left hypochondriac. The stomach is situated at left hypochondriac region. When does the government of India launch National Mental Health Program? In the year of 1982. Complete displacement of articular surface of the joint is called dislocation. Dislocation means complete dislocation displacement of articular surface of the joint. Complete displacement of articular surface of joint is called dislocation. What is called an olfactory hallucination? Olfactory hallucination means false perception of smell. Who proposed the 6 stages of moral development? Lawrence Kohlberg. What is called percussion in physical examination? Act of tapping is called percussion in physical examination. What is called thanatophobia? The fear of death is called thanatophobia. What is the purpose of evisceration? Diminish the bulk of fetus is called evisceration. The disparity in relation between the fetal head and metapelvis is called cephalopelvic disproportion. Which of the following organ enlarges due to malarial infection? The correct answer is spleen. Which of the following is called second process nociceptive pain? The correct answer is transmission. Which type of diarrhea is common for child with Crohn's disease? The correct answer is exudative diarrhea. What is the process of complete elimination of destruction of all microorganisms, including its spores? The correct answer is sterilization. What is the main objective of universal precautions? The correct answer is prevent the spread of blood-borne pathogens. What is called acropathy in hypothyroidism? The correct answer is digital clubbing and swelling of fingers. Which of the following is called a primary link in the development of disease? The correct answer is agent. Which of the following is anti-manic drug? The correct answer is lithium carbonate. What is delusion? False personal belief is called delusion. What is the normal weight of the placenta at term? 500 grams. What is the purpose of Lovett scale? The correct answer is assessment of musculoskeletal system. A hollow or cracked pot sound is heard during percussion of skull is called backfence sign. Which of the following drug is prescribed to antenatal mother for fetal lung maturation? The correct answer is betamethasone. How long does the distensible vaginal tubes to involute? The correct answer is 4 to 8 weeks. Which of the following is the screening method of cervical cancer for a woman aged between 30 to 65 years old? The correct answer co-testing with HPV test and PAP test. Which of the following is an obsessive compulsive disorder? The correct answer is repetitive thoughts and behavior pattern. Which of the following is hormonal disorder caused by high level of cortisol in blood? The correct answer is Cushing syndrome. Which of the following diagnostic test is used to detect neural tube defects? The correct answer is maternal serum alpha fetoprotein test. Which of the following drug which of the following is responsible for regeneration of epidermal cells? The correct answer is keratinocytes. Which of the following sequence is called a model of communication process? The correct answer is source to message to channel, channel to receiver. Which of the following is the process of providing information and motivation regarding health habits and lifestyles? The correct answer is education. The next question. Which of the following condition that has recurrent sudden episodes of irresistible sleep attack of a short duration? The correct answer is narcolepsy. Which of the following is called bulimia nervosa? The correct answer is eating disorder. Which of the following is the primary target cell of HIV? The correct answer is CD4 plus T cell. Hemoglobin appears in which stage of erythropoiesis? The correct stage is intermediate normoblast stage. How many years that the blood can be stored in autologous donation or elective phlebotomy? The correct answer is up to 10 years. Infection transmitted directly from mother to an embryo or fetus or baby is called vertical transmission. Which bacterial toxin that blocks the acetylcholine at neuromuscular junction? The correct answer is botulism. In which of the following does the immunity, immunity occurs naturally through the transfer of immunoglobulins across the placental membrane? The correct answer is passive acquired immunity. Which of the following condition that reveals boot-shaped heart is radiography? The correct answer is tetralogy of Fallot. When the embryo can be differentiated as human. When the embryo can be differentiated as human. The correct answer is 8 weeks. Which one of the following is responsible for color discrimination in eye? The correct answer is cone cells. Which of the following muscle is called non-striated muscles? The correct answer is smooth muscles. Who proposed the model of preventive psychiatry in community mental health nursing? The correct answer is Gerald Kaplan. Which one of the following that forms a barrier between host and the germs? The correct answer is personal protective equipment. How many bones forms the axial skeletal? 80 bones. Which of the following germinal cells that develops bone, cartilage, kidney, and pleural cavity of fetus? The correct answer is mesoderm layer. On which area does the medication act on buccal administration? The correct answer is mucous membrane. What is the process of separating the harmful and harmless waste? The correct answer is segregation. How many pairs of cranial nerves are present in human body? The correct answer is 12 pairs of cranial nerves present in human body. Which of the following is called the endometrium of the pregnant uterus? Decidua is called the endometrium of pregnant uterus. Which of the following is known as swimmer ear? Otitis externa is called swimmer ear. What is called the comprehensive assessment of entire community? Community diagnosis is called the comprehensive assessment of entire community. Drug used to treat ectopic pregnancy with low HCG levels is signal dose of methotrexate medicine. Next question. Which one of the following is the procedure of choice when unruptured tubal pregnancy is found in women who want to preserve their fertility? The correct answer is linear salpingostomy. When a fertilized egg implants itself outside of the womb, usually in one of the following fallopian tubes can be diagnosed as. The correct answer is ectopic pregnancy. Which of the following that transport the egg from ovary to the uterus? The correct answer is fallopian tube. Increased pressure in the portal venous system is due to splanchnic vasodilation. Liver tissue is replaced with a fibrotic tissue that alters the normal function of the liver is called as cirrhosis. In cirrhosis, the space of tissue is filled with scar tissue. What is the most common form of liver cancer often seen in people with chronic liver diseases like cirrhosis? The correct answer is hepatocellular. Which of the following is the main function of leukocyte? Protection of the body against infection and foreign substances. During blood coagulation, thromboplastin is released by platelets. Red blood cells are also known as. The correct answer is erythrocyte. The blood corpuscles are of dashed kinds. The correct answer is three kinds. The primary purpose of plasma is to extend transport except the correct answer is vitamins. Decreased urine production is called oliguria. What refers to elevations in nitrogenous waste? The correct answer is azotemia. P-renal, P-renal failure is manifested by sharp decrease in urine output and a disproportionate elevation of dash in relation to serum creatinine levels. Pre-renal failure is manifested by a sharp decrease in urine output and a disproportionate elevation of in relation to serum creatinine levels. The correct answer is blood urea nitrogen. Failure, the most common form of acute renal failure, is characterized by marked decrease in renal blood flow. Pre-renal. Complications of acute renal failure can lead to organ failure. Thank you all.